Okay, today I'm going to be demonstrating suctioning on a trach site. I'm going to first start with hand hygiene before I enter the patient, or after knocking and entering the patient's room, and I'm going to walk in. And if the patient was conscious, I would verify their name and date of birth verbally, but I would just verify it on their wristband to make sure that I am with the correct patient. And I would also introduce myself as the nursing student. I would assess for respiratory rate, depth, and rhythm, and their pulse oximetry results, as well as any signs of respiratory distress or any cyanosis, anything like that to need suctioning, and this patient does need suctioning. So I'm going to go ahead and demonstrate that, starting with donning sterile gloves. So normally gloves would come in the package, but these are going to be my sterile gloves for the purposes of this demonstration. I'm going to pick it up and orient them. And I can fix the glove after if it is messed up, and then I will go under the cuff on the other glove, orient, and pull it down. Now I will go ahead and open up my suction package and remove the suction piece. If this were in the hospital setting, I would have a sterile drape. So for the purposes of this, I will pretend that this drape on the table is sterile, and there would be a drape over the patient. Then I would take my sterile saline, unscrew the cap, and lip it, and then pour it into the container. Close that back off and set it down. And then with my non-dominant hand, I am going to grab the suction tubing off the wall and attach the sterile end without touching the connection tubing with my sterile hand. Then I will dip the end of this into the saline and suction some of it up, making sure it's suctioning onto the wall. And then I will be coming over to my patient and suctioning, making sure that I'm putting in the tubing no more than 6 inches or until I meet resistance. And then I'll be suctioning this for periods of no longer than 15 seconds with 30 seconds of rest, as many times as needed to clear the secretions. After I'm done, I will take the tubing and wrap it up into my hand, and then I will be removing my glove, and then I would take the connection tubing off the wall and suction the normal saline to clear out the tubing. And then after that, I would hang the tubing back up on the wall, take my other glove off, perform hand hygiene, and check the patient, make sure that he's good, make sure that his site is clean, and if it was to be dirty or anything like that and needs to be cleaned, we would perform trach care, and then I would if need be, I would perform oral care after the suctioning. Because this patient is unconscious, I would go ahead and perform oral care or oral hygiene, and just